Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist. Did you know that a type of trauma to your body is eye trauma? Today, I want to share some of the top causes of trauma to the eye. I just came off a week of trauma call. A lot of these injuries are things that I've seen over the past couple weeks. I want to make sure that this never happens to you or your loved ones. So let's get started. A very common injury that we see both on call as well as in my clinic are chemical injuries. Things like bleach, acetone, household chemicals, or cleaning supplies getting into the eye. This can be very serious because a lot of these chemicals are alkaline and have a higher pH. Getting into the eye can actually cause irreparable damage to your ocular surface. If you ever get any kind of chemical in your eye, the first thing you need to do before you do anything is to flush the eye with water for as long as you can, 10-15 minutes. If you have saline solution, that would always be best. If not, just tap water to the eye, and you just want to get out as much as you can as soon as possible. The next thing that you want to do is make sure you go to the nearest urgent care or emergency room, where hopefully they will continue to flush out the eye using either eye wash or a special contact lens meant for chemical injuries to the eye. After that, you want to make sure that you are seeing an ophthalmologist, specifically if you can, a cornea specialist. The reason why is that the most devastating consequence of a chemical injury is damage to cells called limbal stem cells. Limbal stem cells differentiate the white part of the eye, the conjunctiva, from the cornea or the clear part of the eye. And if you have chemical injuries to the eye, you can damage these cells. If you damage your limbal stem cells, you may have the white part of the eye actually grow on to the clear part of your eye. Unfortunately, limbal stem cell deficiency or damage of the limbal stem cells is one of the most difficult diseases to treat. We don't have a good cure for it, and unfortunately, once you lose them, they don't repopulate. Avoid getting chemicals in your eye, especially alkaline chemicals if possible. If you ever do, now you know what to do. Another very common and surprising eye injury is injury from wine and champagne bottle. When you see any kind of projectile object pointing towards your eye is never a great thing. It's more common than you think for that champagne cork to hit the eye. If the cork hits the eye at a high velocity at the right angle, this can actually cause a lot of damage to the eye. And the worst case scenario is that this may result in enough of a injury where the eye is open to the environment. We call this a ruptured globe. This is one of the few emergencies in ophthalmology. If you have any loss of vision, curtains, or very severe eye pain, it is very important for you to go to the emergency room so that they can make sure that there is no emergent eye injury. Another very common type of injury that we see as ophthalmologists are workplace injuries, especially if you work somewhere where there's a lot of grinding of metal on metal. First off, it's very important to make sure you are wearing the correct eye protection so that you can avoid these injuries. If you do have a metallic foreign body into your eye, it's very important to make sure that you get it removed. Or if the metal is lodged pretty deep within the structures of the eye, you may need to have surgery for removal. Another surprising cause of eye injuries are sports-related injuries. So a few common ones that I've seen recently are high projectile, small balls to the eye, workout bands, bungee cords. It's always best to make sure that you don't have any kind of process or injury that needs to be treated or repaired. My least favorite injury is going to be the firecracker injury. A lot of times when you do have a firecracker to the eye, there's usually a lot of damage, not just to the eye, but the hands and the face. And sometimes there's just not much we can do to repair the eye. First off, I do not condone the use of firecrackers, especially given how awful some of these injuries are. If you are using firecrackers, the first thing is to make sure you follow all the safety guidelines. If you do end up having any sort of injury, make sure you go to the emergency room right away. This is not something you want to sit on. There are lots of other types of eye emergencies that I see during trauma call as well as in my clinic. If you're interested in hearing more about them, let me know in the comments below. Thanks for watching. I'll see you in my next video.